Hello and welcome to this ICSA Labs webinar, Jumpstart Strategies for 2014 Edition Certification. My name is Michael Haas and I am the Healthcare Account Executive at ICSA Labs. The goal of this webinar is to provide you with a few concrete certification strategies that you can use as a roadmap for achieving 2014 Edition certification. This webinar will run about 20 minutes and the slides are available. If you'd like to have a copy of those, my contact information will be provided at the end of the webinar. Please feel free to contact me and I will send those to you. Our goal in helping you achieve 2014 Edition certification via this webinar will be attained by looking at four specific areas. First, we'll take a look at the Center for Medicare Medicaid Services Meaningful Use Incentive Program update, specifically what it says about the value of 2014 Edition certification. Next, we'll be looking at certification requirements for the 2014 Edition, specifically to try to help you answer the question, what must I test in order to earn a certification in the 2014 Edition program? Then we'll move on and conduct a brief review of GAP certification and how that shapes your approach to 2014 Edition certification. And then finally, we'll provide a few simple, practical strategies that you can use to attain 2014 Edition certification. So our first point, we want to look at the CMS Meaningful Use Incentive Update. For quite a while now, CMS has been using incentive payments. These are payments made to hospitals and healthcare professionals as an incentive, as a method to encourage the adoption of electronic health records systems. As of March 2013, the latest CMS report, roughly 4,300 eligible hospitals had registered for incentive payments and 259,000 eligible professionals had registered for incentive payments. When you look at the number of registrants compared to their market sizes, you see that about 80% of hospitals and roughly 50% of eligible professionals had registered for incentive payments in March of 2013. That still leaves a very large market, quite a sizable number of eligible professionals, particularly, that still will need to register for their incentive payments. We know in the future the incentives are going to go away, and CMS will actually begin withholding reimbursements for those who have not registered and attested for meaningful use. So the point from this latest report from CMS is that software that's certified to these ONC standards, namely the 2014 edition, is going to continue to be in demand for some time. Next, let's take a look at the Meaningful Use Update specifically as it relates to 2011 Edition certification and 2014 Edition certification. In the table we've presented here, the first three columns on the left, the plain non-highlighted columns, tell the story of the law of the land when it comes to EHR certification. For 2013 and many prior years, eligible professionals and hospitals could make their meaningful use attestations using either 2011 edition or 2014 edition certified software. However, if you look at the column on the right, that's where I want to draw your attention, the highlighted column, we see that for meaningful use attestations going forward in the future, eligible professionals and eligible hospitals will be required to have 2014 edition software only. Now, the periods for which this rule kicks in, for eligible professionals, it's of course January 1st of 2014. Eligible hospitals, however, work on a fiscal year, and their the beginning of their fiscal year is October 1st of 2013. So you can see 2014 edition certification is going to be key for end users whenever they begin their either calendar year or fiscal year, and it's certainly worth pursuing early. Having a listing on the 2014 edition section of the Certified Health IT Product List website, the chapel as it's referred to, certainly is going to demonstrate your company's commitment to helping eligible professionals and eligible hospitals meet their federal incentive requirements. And it's also going to show that your company is committed to innovation, technical competency, and that you can provide those robust feature sets that are required by ONC. Earning a chapel listing also has a bit of a marketing advantage right now. There are not many firms that have achieved certification. At current time, as of May 17th of 2013, there are only 62 products from a total of 25 vendors that are listed in both domains and in complete or modular form on the Chapel site. So certifying a product early will definitely get you in some elite company. Well, we know that 2014 edition certification is going to become the law of the land soon. So let's look next at some certification requirements around the 2014 edition. The good news for all vendors is that the 2014 edition certification requirements, the minimums have been greatly reduced. If you'll recall, under the 2011 edition, in order for a product to attain a certification of any type, you had to test and certify against the privacy and security modules, these 8 modules that are on the screen right now. For the 2014 edition, there's only one required module that you absolutely must test and certify against in order to have a certification listing issued, and that is the module around the quality management system, 170314G4. Now, there's a special consideration. ONC has approached this from a bit different angle than most folks think. This particular module is an attestation-based module where you indicate and describe the type of quality management system you're using to develop and maintain your product. There is no right or wrong answer necessarily for this module. There's no way to fail it. You're not required to use a quality management system, but CMS just wants you to report and describe what type of management system you're using. The type of quality management system you use, it could be an internal quality management or quality control system that your company has developed and maintained over time. You may also be using a type of external, internationally created and recognized quality management system, such as an ISO 9001 or ISO 17025 or ISO 27001. If you're using any of those types of systems, you'll want to document those. And you can also indicate that your company is not using any quality management system. That is okay by ONC as well. You'll want to keep in mind that with this particular module, the results will be publicly posted in a report form. So as you're writing up the description of the quality management system you're using, you'll want to just make sure that you present it in a positive and favorable light, as it will be viewed by the public. Well, that's the minimum requirement change in the 2014 edition. There's also one other change, a concept that ONC has brought into play, and it's a concept known as module dependency. Now, here is a list. If you are going to test in the 2014 edition against any of these modules: CPOE, computerized provider order entry, drug-drug or drug allergy interaction checks, medication list, medication allergy list, clinical decision support, electronic medication administration record, e-prescribing, or clinical information reconciliation. If you want to test and certify against any of those modules, they contain functionality that is dependent upon a module in the 2014 edition, Safety Enhanced Design. So if you're testing any of the modules in that upper list there, you do also need to test and certify against the Safety Enhanced Design module. And you might think of Safety Enhanced Design more of a type of usability testing. This particular module is, again, an attestation-based module. There's not a physical test inspection required for this. You would submit an attestation based on the type of usability testing you've performed in relation to any of those modules in the list. And there is one other module dependency, and it revolves around this long list of modules. If you're looking to test and certify against any of these modules that you see on the screen, you'll also need to make a decision about testing against automated number recording, that's 170314G1, or automated measure calculation, 170314G2. The second module in that list, automated measure calculation, is required if you're targeting a complete EHR certification. If you're pursuing a modular certification, you have the option of testing either automated numerator recording or automated measure calculation. But once again, ONC's ruling on this is that functionality in the list of modules there that you see is dependent upon features that are tested in automated numerator recording and automated measure calculation, and therefore if you're testing any of those out of that long list of modules, you also need to test one or the other of that module pair, automated numerator recording or automated measure calculation. Well, let's move on now. As we've looked at how the requirements for 2014 edition certification can shape your approach to a Jumpstart strategy, let's also briefly review the concept, the rule around GAP certification. If you remember, there were a number of test procedures in the 2011 edition that remained unchanged going into the 2014 edition. And so ONC, in order to eliminate some of the testing and regulatory overhead, they introduced the concept of GAP certification. And from the Federal Register, I'll present to you their official statement about GAP certification. And it says here, for EHR technology previously certified to the 2011 edition EHR certification criteria, GAP certification will permit, where applicable, the use of prior test results for certification to the 2014 edition certification criteria. Stating it another way, what this means is there were a number of modules, 13 to be exact, from the 2011 edition whose test procedures remained unmodified. And as a result of that, you may use the 2011 edition results to certify against the 2014 edition criteria. Now briefly, here is a list of all of the modules that were eligible for GAP certification from the 2011 edition. There were a total of 13, and what's interesting to note is that if you look in the middle of the list, beginning at 173.020 and going down through 173.02T, you'll see that those modules are related to the privacy and security suite that were required for everyone to test and certify in the 2011 edition. As a result, since some of those are GAP eligible, then that leads you to be able to certify very quickly. Many vendors do have a head start on 2014 edition certification since those modules are GAP eligible and previous test results can be used. Now, of course, it's up to the testing labs and the certification bodies to determine each situation where GAP certification is going to be used. So please follow up with me either today or whenever you have a chance. We'll be happy to conduct a call and discuss GAP certification with you. That's no problem. Well, let's look at then a couple of examples, some approaches that you might consider for 2014 edition certification. One example, one way you might approach it, is a two-phase testing option, where in a first phase of testing, you might consider testing that required module, 170.314G4 for quality management system, and along with it, you might be able to test and certify all of the privacy and security criteria that do not have any module dependencies built in with them, and I've put that list of modules on the screen there. Again, in this particular situation, there would not be a physical test inspection related to this type of approach, and so in a second phase, you might come back and test all of the remaining modules that you need to reach your modular or complete certification listing for the 2014 edition certification. Another approach, here's another example. Instead of a two-phase approach, you may also consider, you may want to consider, a multiple-phased approach. In phase one, you would test only that module that's required for listing and certify that, the quality management system. And then in a second phase, you could come back and test any modules that were related to core functionality, or you could knock out some of those modules that are eligible for GAP certification. And then in future phases, a third phase, a fourth phase, however many you like, you could test additional modules that you'd like to that will help you achieve that modular or complete 2014 edition certification. And you can also in future phases, test additional criteria as needed as your product evolves or is developed, or as it's modified to maybe reach different market segments that it's not currently serving now. So with those two examples, it's fair to ask the question, why certify now? What's the value in early certification? Well, first of all, as I mentioned before, currently the Chapel website has listings that have only been achieved by 25 vendors. And that, again, includes modular listings, complete listings, ambulatory, and inpatient domains. Only 25 vendors, a total of 62 products, have achieved listings. So getting a listing early will definitely put you in an elite group. Also, it's good for your prospects and customers to see that, be able to go out to the Chapel and actually see that you're pursuing 2014 edition certification. Again, it's going to demonstrate that you're committed to helping them meet their federal government's incentive requirements, and also that you're committed to keeping the product up to date with the latest technological changes. Next, another reason to certify is that for some of those phase 1 scenarios where you are going to be testing and certifying the attestation-based modules, the quality management system, along with gap-eligible criteria, certifications can be completed fairly quickly. It's not unreasonable to expect that we could have a listing completed and up on that Chapel website in as little as 3 weeks. So something to consider there. You could get a splash in the marketplace on the Chapel very quickly. Also, ICSA Labs is offering fee waivers, a special fee waiver for any contract for phase testing that's executed between now and June 30 of 2013. Normally, when we conduct testing in phases, whether it's 2 phases or 3 or 4, each test session has a testing fee, a base testing fee associated with that. For this particular special time period in this offer that we're conducting, we will be waiving all of those fees, again, for contracts executed through June 30 of 2012. Another example, another good reason why you might want to consider certifying now, remember when you enroll with ICSA Labs, regardless of how many or how few modules you're going to be testing in a first phase, we provide you with our guidance document that includes all of the test scripts for all of the procedures. As many of you know that have used our 2011 edition test script document, we've made many enhancements, and the 2014 edition document is even better. We take the test scripts, the approved test procedures from the ONC website, we wrap those with our guidance and tips and hints to help your product refinements and test sessions go smoothly. And also, we open our lines of communication so that your team may reach out to ours if you have any questions. Yet another reason why to consider certifying now, we've got you get the benefit of the ICSA Labs team availability and experience. In order to ramp up for 2014 testing, we've doubled the size of our testing team. And so again, creating those listings can happen very quickly. We also are very responsive. We respond to all emails and phone calls within a day or 2 business days. And we're happy to speak with you. And once again, our team has over a decade of experience in health IT and security, and we want to maintain our collaborative approach of working with you to help you develop the best testing and certification strategy to meet your 2014 edition certification goals. So if you have any questions, and hopefully this webinar has prompted you to think of some, do feel free to contact me. My contact information and the contact information of my colleagues, Amit Trivedi, our Program Manager for Healthcare, and Michelle Knighton, our Testing Manager for Healthcare, are listed on this slide. Feel free to reach out to us. Remember, the only bad question is the one that doesn't get asked, so do feel free to call us. We're happy to help. We want to thank you for taking the time to view this webinar today. We hope you have a great remainder of the day, and we look forward to working with you in the future.